Nick had like a bird haircut.
What?
Nick had like a bird haircut.
Yeah, I know, because Joe didn't brush him. So he had bats. That's why. You know, if you use a Furminator on him, you should be fine.
Yeah.
That's what we use on George, very Furminator, and keeps him from matting.
Sweetie brushes him. He hates to be brushed.
Oh, okay. Sugar loved to be brushed. He would just turn and turn.
Well, Goliath puts up with it. He can tell he puts up.
And you've been sitting much too long, much too long. Welcome, 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 welcome to Truth, a radio program designed with you in mind, a program whose sole purpose is to empower you, our listeners, for information leads to knowledge, and knowledge is power. And as always, we want to empower you to take control of your life, those things that impact you, your family, and your community. As always, too, we want you to go to the website at www.gwen-truth.com so you can access all of those resource listings, and all of those links to the all-powerful information. As has been stated, I'm Gwen Azama-Edwards, former city commissioner, retired city clerk, city of Daytona Beach, Florida, and author, minister, community volunteer, extraordinaire, blah, 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 blah. Oh, lover of people, and someone who always wants to help when she can. I want to do a shout out to all of our listeners. I want to do a shout out too to all of those who were able to come to the how do I put this now? Renewal of vows. My husband and I celebrate our 25th wedding anniversary. And he actually enjoyed it. Didn't really want to do it initially, but loved the fact that we did it now. And family, friends, and so many others I know who could have come, would have come. Oh gosh, it just got to be so hectic with so many people coming in from different parts of the U.S. who had flight cancellations and trying to do this and trying to do that. But all's well that ends well. So shout out to my hubby of 25 years, Larry T. Edwards, Reverend Larry Edwards. Love you, love you, love you. Shout out to my sons who stood in for my deceased father. Shout out to my older sister, that's Curtis and Anthony, sons. My older sister Dolores who stood in for my deceased mother. And my girlfriend from Colorado who was the maid of honor. And all those great and wonderful and awesome people, nieces, nephews, blah, 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 who did it all. Thank you, thank you, thank you, thank you. And I know best wishes have come from so many of you, and I just thank you for all of your best wishes, all of your support, all of your assistance. It's something you should do if you can do it. A lot of work, but well worth the effort. It reminded me of that commercial, and I'll say this to my friend who is here and who is our guest tonight, Joyce Case. Reminded me of that commercial where you see all of these things and it says how much this costs and how much that costs, and then it says some sweet and wonderful thing that just tugs at your heart, and it says priceless. And that's what I say about whatever the cost in terms of renewal of vows, 25th wedding anniversary, priceless. What we got from it was priceless. So shout out to all of those who were a part of that, all of those who continue to send us best wishes. We thank you, thank you, thank you. Now, our guest tonight is someone who has been on the show before, when she was on before, Linda Merrill, who's a child advocate, and someone who's well into this healthcare thingy, but into healthcare and ensuring healthcare provision for not only the youth, but people generally. And they did a fantastic job. But Joyce is on tonight, Joyce Case, who is the Navigator Coordinator with the Health Planning Council of Northeast Florida. And we're going to talk about the Affordable Care Act. We're going to talk about the progress thus far and really try to help some of you who are still kind of standing in the gap, trying to decide if you want to check it out, if you want to apply, if you qualify and all this good stuff. Trying to give you some information that will help you to at least get to the point where you go and check it out, because the time frame is nearing very quickly, March 1st, when you have to be signed up or you will face penalties. That's for certain ones, okay? Others of you, you have what you need, etc., and we're going to go through some of that. So Welcome, 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 Joyce, and thank you so much for coming. And please thank the individual who works with you, who I correspond with from time to time when I'm trying to get you because you're so busy. David Weiss, he really has been just a super individual to work with, and I'm just so grateful to him for all that he did in terms of trying to get everything lined up too. So please pass that on to him.
I will.
Okay. Share with us, give us an update in terms of how are things going, because you're handling, which counties are you handling? Volusia?
Flagler, Duval, Clay, Baker, Nassau, and St. John's.
Wow, okay.
7 counties.
Wow. In terms of, because our concern, of course, is Volusia and Flagler County. Those are the 2 areas that this radio show covers.
Mm-hmm.
How are we looking? Are things up in terms of enrollment, up in terms of the availability and the computer working great and all that good stuff?
Everything's going really well. They upgraded the website as of November 30th, and then continue to improve it all throughout December and January, and there's a lot of new features on the website that allow us to process applications very quickly. This last weekend it was down because Social Security was doing a maintenance of their system, so if anybody was on this weekend and started an application and saved the application, they will be able to purchase the plan if they do that and enroll in a plan, and they will have coverage effective March the 1st. But right now, the website's working very well. You can actually go on, create an account, complete your application, and get a determination of what your tax credit would be towards your premium almost immediately.
Mm.
It comes back that quickly. So then the challenge is looking through the number of plans that are available out there and looking at what those plans are, what they have covered, and what is within your price range.
Now, one of the things we covered the last time, and I want us to spend a little more time on that tonight, in the area where individuals reside, there are certain plans which may be different from the plans in other areas, and it's and what's available and the criteria, whatever, how is that determined?
Well, each of the plans, each of the insurance providers had to submit to the federal government and be approved in order to be on the marketplace, to be a qualified health plan. And then they bid, or they made their proposals to the federal government on what counties that they would serve. Early on, we knew that Florida Blue was covering all 67 counties in Florida. We knew they were going to be in all of them. But some of the other insurance providers ended up not being in all the counties. Like Florida Health Plan is not in all the counties. It's in Volusia County. Cigna is not in all the counties, but it is in Volusia County, Florida Blue, and Coventry, which is is another plan that's available, and it what I've seen of it is probably one of the most economical of the plans. So that's how they determine where they were at. Some counties have actually only one insurance option, and that would probably be Florida Blue if there's no other provider in that community.
And we have heard through the news media that some people are paying astronomical cost or prices for health insurance. We've heard from some people who pay practically nothing. What generally are they looking at in terms of making that type of a determination? Because you were saying that if you have more money, then you pay more.
Right. So if you are between 100 and 400% of poverty, and those rates are based on the federal poverty scale that are published every year in the Federal Register. And actually, the federal poverty levels that they're going to use are through March 31st, through the end of enrollment, are going to be the 2013 FPLs, federal poverty levels. So an individual can make $11,460, and that is right at 100% of poverty. They're going to get a greater tax credit than someone who makes more than that. That just makes cents.
Mm-hmm.
So, but you can be a family of four, and 400% of poverty for a family of four up to almost $95,000 a year would qualify for a premium tax credit. But it may not be as great as the individual that makes closer to 100% of poverty.
Mm-hmm.
And then anyone outside of that is not going to get a tax credit. So anybody that's above 400% of poverty is not going to get a premium tax credit.
Okay, and then a lot of us have heard about, the Medicaid expansion, the fact that Florida and some other states did not accept that, did not actually do that and approve it for their state. Who's affected by that, and how does it affect them?
Well, individuals that are at 100% of poverty or less and do not meet the criteria for Medicaid, which mostly is adults without children, they do not qualify for a premium tax credit. So if they were wanting to purchase a plan on the marketplace, the plan would be without a tax credit. And so whatever those premiums would be, $400, $500, $600 per month, would probably be outside of their ability to pay. So that's where it affects them. Now, the good thing about those individuals' situation is they're currently relying on a safety net, a group of providers like the health department and Halifax, who does the indigent care programs. They currently are in those systems with all the people that are now going to start to have coverage. So those that have coverage will be able to go outside of the safety net and therefore won't be bogging that system down. So those individuals will see that they'll be able to get primary care visits much quicker because the burden of that system is no longer carrying all those individuals that have chosen not to have health insurance or can now afford health insurance through the health insurance marketplace.
I was at Walmart the other day returning something, and there was a gentleman who had a table set up right at the entrance. He's there, this particular neighborhood Walmart in Holly Hill. He's there, I think he said either Mondays and Thursdays or Tuesdays and Thursdays in the afternoon. But he said, he's an insurance broker. So, and we mentioned that briefly the last show as well. So there are individuals, if they do not choose to go through the navigators who are available to assist, there are certified, I guess I'm using the right terminology, insurance brokers, and individuals can actually check with their own insurance people to see if they are so certified.
Yes, they can use a broker. Now the good thing about using brokers is that they will get a commission